Welcome back to Ready to Play Week. We're so excited that we have this opportunity to share our thoughts and really get down into the real essence of what it means to safely return to sports. We've kicked this thing off with really an all-star cast of science professionals, people that are involved in healthcare, but really involved in sports science and in sports medicine. We're joined by Dr. Smith. David Smith is Dr. Smith, your title is kind of fluctuates. Can you just tell me what your official title is? Because I'm not really sure. I put director of sports science, but I'm not really sure what that. What is your title?
So basically, I'm an associate professor at the University of Kansas Health System, but I'm the medical director for our youth sports medicine program at KU Health System. And that's really the hat that I'm wearing today as we talk about this sports.
And you also an advisor for the state of Kansas high school athletic. You're on their advisory.
Yeah, I sit on what's called the Sports Medicine Advisory Committee for the Kansas State High School Athletic Association, KSHA. And we have a committee that's comprised of physicians, athletic trainers, athletic directors. We have some KSHA representatives, including the executive director of that, Bill Faflick, and Brent Unruh, who's also works with them. So yeah, it's a very good committee. We evaluate the things that we're going to be talking about today.
Well, Bill Faflick is going to be on the show Wednesday when we focus on high school. So I got to know him when I listened to you and the KU news conference I was invited to, and so we're going to get him on to talk about Kansas high schools. Also joining us is Dr. Kevin Latz from Children's Mercy Hospital. You are chief of youth sports medicine at Children's Mercy Hospital, correct?
I'm a carpenter. I'm a frustrated orthopedic surgeon, and then I'm chief of sports medicine at Children's Mercy. Correct.
That's great. And then Dr. Katherine Satterwhite. I've been connected with Dr. Satterwhite for about a year and a half now. I kind of caught on to what the Health and Human Services have put out as far as their national youth sports strategy. Katherine works out of Region 7, the office that covers the Midwest. She is a deputy. Your title.
Yeah, I got you. I'm the regional health administrator for Secretary for Health, and actually, that's just part of the title. But we'll just leave it at that.
Right. Well, I'm Bill Brandmeier. I run an organization called ShareWaves. We are putting together Ready to Play Week with Will to Succeed Foundation. We're raising awareness on the exact nature of what we're faced as we re-engage with sports here in Kansas City. One of the things that is so important to us is that when we get back out on the fields, we do it safely. And I just want to kind of open things up to each of you. As we re-engage, it's taken place over the last 6 weeks, but really the last 3 weeks, we're back out on the fields here in Kansas City. People in the stands watching their kids play. What is it that you're feeling in terms of medical experts? I know that giving advice is part of what you've been asked to do over the course of the last, 9 weeks, 10 weeks. What is it you're sensing? What are you feeling? Let's start with you, Dr. Satterwhite, and then let's work our way around.
Yeah, absolutely. So first of all, when I'm driving around, I'm really happy to see people outside, to see people back on some of the school district fields. Some of them had been closed. So having these big, expansive spaces where they can throw a ball, run around, and do sports and activities that still adhere to those some of those social distancing policies that still remain important. However, having said that, I have seen some things that I wish were a little different too. I want to encourage and keep those opportunities because sports are so important and in so many ways. But we as a community need to also remember that there are things that we can do to keep situations still sustainable and safe and reduce the risk of losing those opportunities if we have to stay at home again. And I can talk more about those later.
Dr. Smith, when I listened to you, you were a big advocate of making sure that we're outside, that outside is really an important part of it. Is that enough? What are your thoughts?
Yeah, well, I agree with the two that just made those comments. That I've said all along, starting youth sports is really not the issue. I think we started at the right time, but continuing youth sports is the issue. And as we move forward, literally day to day and week to week, we're learning more things. We'll hear at the collegiate level how many have tested positive at K-State and KU and now Mizzou. But at the youth level, we're not testing all those that are out on the field. So one of the things that we have stressed is how do we mitigate the risk? Being outside is important, that you're not in close contact if you're outside, but you can be outside and be in close contact. So outside sports do reduce the risk. But I would agree, we're entering some uncharted waters here, and it gives me a little concern too. I love seeing the youth out active again. Being sheltered at home, not being able to be with their friends doing activities had to be extremely rough on them. However, getting back out there, I think we've kind of let our guard down just a little bit, and we can't let our guard down right now. If we want to continue sports all the way through the summer and into the fall, the guard has to stay up as we continue to learn more about what's going to happen.
Yeah, Dr. Latz, I know that you're a dad. You've got kids that are playing sports. Dr. Satterwhite, you have kids. Dr. Smith, you have older kids. Is that right? Or do you have younger?
Yes, kids? I have 4 older kids, 3 of whom are married, but they all participated in sports, and we talk about just what the 2 parents that have youth in their families right now participating. I'm glad that I don't have to think about this directly for my own kids, but I sure think about it for all the other parents that have kids going back.
Yeah, it is a challenge, and I think about my son. He's 11. He really thrives in sports, and he doesn't thrive outside of sports. And it really is something that mentally we want to make sure that he gets that social interaction at 11 years old when he's starting to develop, his brain as an adult. I think it's going to be something that we're going to have to pay attention to as we go through the summer, that side of things. Dr. Satterwhite, when Health and Human Services obviously is dealing with so many different issues and so many different things, when it comes to a conversation about the safety and care of kids, child care in our city, what our kids are facing this summer without the normal mechanisms and the normal support networks that would be out there. And I know that Health and Human Services is trying to fund a lot of different things to help fill the gap. What is it about youth sports that we can do to help increase access and keep kids safely kind of engaged?
Yeah, no, it's a great question. So I'm going to take a step back and just put it out there why youth sports are important. So I think when you were talking about your son, it's a perfect example. I have 2 kids who are also heavily involved in sports, and gosh, when they weren't there anymore, they were really impacted, and it wasn't just physically. It was their emotional impact. So I think it's important to remember that this isn't just about physical activity. It's also about emotional well-being and connection to other people. We've heard a lot about social isolation in this time. And because we all are tired of being inside and socially isolated and not doing our favorite things, this is getting back to what Dr. Smith said too. I think we've come out of the door running full speed. And what we need to do is come out of the door at a jog. So if we want to keep people safe, we have to take it incrementally, and that's hard. So thinking about things like outside sports being lower risk. So sports that require close interaction and are played indoors, and even the sports that share equipment, there are challenges that we're going to have to be aware of. So we might have to make some choices about what's okay right now and what's not. My son is in a soccer camp this week, and everybody has to bring their own ball. I mean, even little things like that. Now, when we think about access, that is thinking about that this is important to all kids. Everybody may not have their own ball, so then we might need to be more creative in trying to figure out how not to exclude kids who need additional support, but still need the same opportunities too.
Dr. Latz, your team has done an enormous amount of work trying to put guidelines out there, but it seems really difficult to get people to adhere to sound advice. Like they're chomping at the bit. So
and it's often not a will thing. It's often a resource thing. And so we have relationships with various high schools and various organizations through town, some of which, frankly, they can, like Katherine suggested, if they can bring their own ball, but many that can't, and many that, frankly, don't have the cleaning supplies to even make the weight room safe. And so, like we know in many things, the health disparities do not fall equally on us all. And particularly in our under-resourced districts, it has been a dramatic challenge. So you're right, it is sometimes a will thing to wear a mask, and it's just one more thing to nag my children about. However, often the will is there and just the resources aren't.
Right. Yeah, so, Dr. Smith, I'm not sure how the high schools are hearing the guidance, but it seems like there's you can talk to a high school coach at Blue Valley and a high school coach at Shawnee Mission East and a high school coach up in North Kansas City, and they're all operating under different guidance, different programming, different ideas. Some are working, some aren't. Are you finding that there's some consensus as to what we should be doing, or is it, am I right? Is it just kind of catch as catch can across the board?
I think there's definitely been consensus. A lot of the different school districts that we're involved with have put out policies, guidelines, procedures, many of which started by looking at CDC guidelines or KDHE guidelines or the KSHA guidelines in the state of Kansas. And then looking at those and writing up literally a return to sport this summer, we would review those. Obviously, we can't determine what a district does, but we reviewed them to make sure they were medically sound. Right. We had to have them reviewed at our health system because we're putting athletic trainers out there too to supervise that. And we want our athletic trainers to be healthy so they can care for the student athlete. And so we wanted to make sure that the guidelines were sound, that we had a reporting mechanism if for some reason we have a coach or a parent or an athlete that's not following the guidelines. Do we report them? It's not like we want to call the police, but we want to make sure that the guidelines are adhered to. And if not, then we have a reporting mechanism how to deal with that, and we document it. So as I think there's an interview a few weeks ago that I did where I said, I would like to be out there encouraging the student athlete to adhere to these so they can continue playing. I said, for a coach, I suggest that be part of his game plan. Like you would call a play for a football team or outline a game strategy for the next game. You say, our strategy is going to start with protecting one another and your families. When you go back home from your practice or your game and you're around your parents or your friends, we want to protect one another. That's going to be a game plan for us. That way we can continue to use sports. So these are great guidelines, and I've looked at so many guidelines that literally have guideline on the brain, and yet they seem to keep coming out with the same things. How do we mitigate risk? Outside versus inside. What sports, we call them kind of the red, green, and yellow, danger sports, no danger sports. But I said you could take a green sport. Running cross country was brought up to me. Is that green or yellow or red? And I said, well, if you're practicing and you're 6 feet apart and you're not, breathing in each other's face, you're probably okay because you're not going to wear a mask when you're running cross country. You put them in a meet, that goes up to a yellow because they're running in a pack. They're breathing right next to each other and they're passing through air that someone's breathed. You could take a yellow sport and they start passing around water bottles and that becomes a red sport. So all these are guidelines. Back to your comment, each school district has come out with guidelines, and the ones that we've looked at have been excellent. And I was just on a conference call the other night with our SMAC, our Sports Medicine Advisory Committee, where we're looking at these guidelines relative to educational guidelines, because those are coming out now, how we return students to school and how that's going to affect sports and, of course, the classroom. So these are guidelines continue to evolve.
So Dr. Smith raises a great point, because one thing about youth sports is they don't work without adults and other community involvement, including coaches. And that's something that as spectators or parents or coaches, we also have to help protect the kids, because like Dr. Smith commented, sometimes it's difficult for a kid playing sports to wear a mask, but it's not so hard for a spectator or a parent or even a coach. So in thinking about, again, that the mask protects, your mask protects me, my mask protects you, looking at that role. And then I know I've seen a lot of really good, great recommendations around even limiting spectators. I know we all want to watch our kids, but sometimes maybe just one of us needs to go. If we're in a household, where two of us are available and would like to go.
Dr. Latz, you mentioned an increase in hospitalizations due to the virus. Are you concerned about the younger kids, or less concerned about the younger kids and more concerned about high school kids, high school athletes? Do you think that any age group we should be worried about? Is it the parents and the fans in the stands that we're most worried about?
Right.
What do you think?
Yeah, so I want to be a little careful. And as noted earlier, I'm an orthopedic surgeon, but clearly we know that children are relatively protected. There are some inflammatory responses to this that can make children very, very sick. But generally speaking, the youth are protected to a degree from themselves getting terribly sick. However, we know that they go home and they visit grandparents, and there's folks in the stand. And so, we've really been pretty outspoken with the teams and schools, and then my own personal clubs that my kids play on, that this is probably not the greatest time for you to have fans present. Back to the times when we all played sports, where frankly you got dropped off and picked up and nobody watched you play. That seems harsh, but and that's clearly an extreme. But I would argue that limiting fans and spreading apart fans when they're there. I've just curiously been to a handful of soccer and baseball tournaments already, and the kids are doing a reasonable job. They're limiting the numbers in the dugout and such, but then the dadgum stands it's like nothing ever happened, and so it's a little shocking, and it's hard. We're 3 months into this, and there's no end in sight, and so I completely understand the fatigue, but I really think we just can't let our guard down now.
Yeah, I agree. I think, and Ready to Play Week is really about continuing to push this message that it is critical that we as a community continue to be adhering to the guidance and the recommendations from the experts. And having you guys on here together has just been a huge, incredibly good experience for this week, to kick this week off with the three experts that I've come to know and trust and have the right advice. When you look, what are you looking for? What are you paying attention to over the next 4 weeks, 6 weeks, the rest of the summer? Obviously spikes are happening. The news will tell us that things are happening throughout the different states. They're looking at different numbers, whether or not the hospitalizations are going up or down, the number of cases that are being reported, the number of deaths. Kansas and Missouri seem like they're doing better with hospitalizations, but they're also getting more cases. Obviously, we all went crazy over Memorial Day weekend and partied at the lake, and I didn't, but some of the dumb people did, and I think we're getting a sense that was probably too quick, and it seems like everyone's waking back up to the idea that we're not done yet. So what are you watching in terms of paying attention to that we need to be aware of? Dr. Satterwhite, do you have anything?
I'm going to pivot on you a little bit, though.
Okay, good.
Because I was thinking about Ready to Play, and we've really been talking a lot about the actual competition piece of sports. So what happens during, a lot, not always, but what happens during the game. But I think it's also important to talk about practice a little bit, because from a youth sports perspective, that's also where, we want kids to be learning to move. And so the National Youth Sports Strategy that the federal government put out is really about that, about learning these different things. And we're going to have to do it a little differently now. So whereas sometimes we might scrimmage more, now we might need to do individual drills where people can be spread out more easily. But we're still developing some of that body movement, and we're still getting physical activity, and we're still getting some social connection. We're just not quite as close. Right. So I think thinking about how we can do practices different and better, not better, but different, is also an important thing to think about. So sorry for the pivot, but
no, that's good. I think that what I hear you saying and Ready to Play really was about individual workouts at home, trying to create content for kids to engage with, giving them simple exercises that they can do to help increase their skill set. And we had coaches throughout the city step up and produce these little vignettes of videos, and they were good. And I think people appreciated them for what they were. I think we can do a lot more of that. One thing about COVID is it's given us some time to focus on ourselves a little, right? And maybe do some things personally in our own private time that we wouldn't normally do because, we're going to wait for practice to do that, or we're going to wait, we're going to do that as a group, or, now if you're not getting your 60 minutes in, which is not easy to do for an 11-year-old kid, 60 minutes on the video game is easy. 60 minutes outside practicing by yourself is really hard. Are you concerned that kids aren't getting enough activity every day, Dr.
Yes.
Latz?
Oh, sorry, you guys.
No. Yes.
Yeah, no, that's a no-brainer. We've got, like we always have, this extreme of kids get overuse injuries, and I'm sure Dr. Smith sees like I do every day. And then you've got a group of children that get no activity. And so, yes, like Katherine alluded to, the same, we are now inundated with shoulder and elbow injuries because these baseball, softball athletes now feel like they need to make up for 3 months of lack of training. And so they've gone out and gone full bore. And so, yeah, I mean, that doing the small things to make sure you're ready to play games, that's so vital, because there's nothing worse than waiting 3 months, getting hurt the first 2 weeks, and then you miss the season that you've been waiting for. So, yeah, you cannot gloss over that prep work to get you ready. So you got to get your arm ready. You got to get your flexibility down. And you're right. You got to stay active. You can't go 0 to 60, or you're going to hurt. Even a child is going to hurt themselves. Even an adolescent is going to hurt themselves.
Yeah.
Hey, Bill.
Yes, sir.
I want to step back because I think we kind of accelerated through a very important question that you asked about, people are saying, is this a second surge now? Because we are seeing in the states and in our city an increase. We're hearing that every day, an increase in the numbers. And Dr. Latz commented on the increase in hospitalizations at Children's Mercy. We're seeing that at KU. What I always caution is, let's look at statistics very carefully. What I sense as I review all these stats is, we have an increase in hospitalizations at KU pretty significantly over the past couple of weeks. However, when you look at severity of illness, it doesn't seem to be as severe. People are getting better and going home. We're not seeing as many that are dying, thank goodness. We've learned how to take care of this virus so much better. That's number one. Number two, we are testing more. That's the big question. They say, well, we're testing more, therefore we're going to have more cases. But then you dial that down and you look at the percentage of positive tests. So if someone tests 1,000 people and only, 30 show up positive, well, that's, a pretty low percentage. So we look at this, well, if we can get the percentage positives under 3%, maybe that's a good figure. They were running much higher than that. I can't remember the numbers last week that I looked at, but the percentage of positives are dropping in some areas. Sometimes they're going up. So I looked at that, and that's what we had this conversation the other night on our SMAC committee. I said, here what we're going to find out. We're going to hear at the universities. K-State had 13. Mizzou has 5. KU has 1. Texas has 13. LSU had 20-some. Alabama, like the first few days of practice, had 5 right off the bat. That's because they're testing as they're coming back onto campus before they even start practice. When you look at Mizzou's 5s, I just saw that number today. They had 5 reported positives, but only 1 had some symptoms. So these are asymptomatic carriers, and that's what we got to think about is these youth that are not getting tested are coming to practices, conditioning and things. They could be asymptomatic or pre-symptomatic and potentially passing this along. Yeah. So it goes back to the disparities that Dr. Latz referred to. There's going to be a lot of youth that cannot get tests, whether it's access to the test or the parents don't believe in the test, or maybe the test is a bad test that they're going to get. So it wouldn't it be nice to be able to test all our youth? And then I say maybe it wouldn't be nice because we might be finding a lot of positive asymptomatic carriers coming to practice. So what I say is we go back to the risk mitigation strategies. Let's assume that there's a number coming to practice that are asymptomatic that would test positive if we had the test. How do we reduce the risk? Right. Stay outside, stay your distance, wash your hands. Don't come to practice if you're sick. Check in with your primary care provider if there's any question. And then if there's a positive on the team, that's another big question. What do you do? Well, contact tracing takes over. And that's what the authorities have to do that properly and then advise us what happens next. Right. So do you stay home for 14 days? Do you go get tested? What do you do? That's going to be a big question, too, as we move forward.
So this may sound a little naive. I don't really know how it works. But if somebody on my team tests positive, is it automatically reported, or am I responsible for reporting that as the head coach? I don't even know.
That's a reportable illness. That's okay. Reportable.
So now, it doesn't mean COVID, right?
Yeah. So we have with our schools, again, we're sending athletic trainers out to be there to help them with their conditioning and practices. If that were to come up, that's reported to the KDHE and the county health department, in which and then they take over. We had that question the other night from a school nurse that sits on our committee. Well, should I be a contact tracer? I said, no, you've got enough to do when you're at school as a nurse. We have authorities that have been trained in that. You can actually take a class through a Johns Hopkins program on how to contact trace. And it would be neat to take that class to learn about it. But what we need to do is let the people that do this best do it, and then do it the right way, and then advise us what happens next.
Well, that's go ahead, Katherine.
Yeah, and that's perfect. So I think we need to do what we can. So just like Dr. Smith was talking about, let the health authorities do what they do best. And we as supporters of youth sports do what we do best, whether that's advising, if it's spectating, wearing a mask, a cloth face covering, helping kids stay distant. So each person has their own role to play, both in encouraging youth sports and keeping kids safe.
Well, that's awesome. And that's, seeking advice from the experts is really what I think all of us should be doing. We should be adhering to the guidelines and making sure that we're protecting our families and protecting the people around us and in our community. Everyone should be wearing masks when they're in, in groups that they're not normally around. And it's something that I think that is, we need to definitely step up our game here in the Midwest. If we don't want this thing to unravel on us, which, I'm afraid it might if we don't change our behavior a little bit. But I want to thank you all. I don't have a final question. I don't have a final ending to this. I think that where I want to leave this is with your final thoughts on what it means to be ready to play in returning safely. And really, I would just want to encourage you all to listen to what we're talking about all week. And if there's anything that comes out throughout the week that you want to get back on the radio and talk about as we go through this, or if there's something that I can say that I'm not saying as we go live every single day, 1 to 3 on 95.5 and 1510 AM, 94.5 FM, 1510 AM. Just send me a text and just let me know that there's something to add. And if there's something that emerges, I know I'm going to get a chance to talk to one of your doctors later on this week that works for you, Dr. Latz. So we'll definitely continue this conversation with him. But if there's anything else that I can add to the conversation as we go through the week, don't hesitate to reach out to me. And just let me know your final thoughts. What do you guys think? Catherine, you go first. Say goodbye.
Sure, happy to. I just want us to remember that in this case, as we're talking about youth sports, it's about the kids. So I think recognizing the importance that sports play in kids' life and doing what we can to help make that a possibility still remain really important to me and to kids. And so thank you to my fellow chatting mates, my fellow Zoomers, for your awesome comments.
Yeah. Dr. Latz.
Hey, Bill, thank you very much for the opportunity. First of all, very grateful. Youth sports are powerful, and we want to keep kids playing. And I don't think people should feel impotent. There are things we can do, Dave alluded to, that, that are not hard. Wearing a mask, staying physically apart from each other. Those are doable, solvable things. And so let's keep these kids involved and active and let them appreciate all that the sports have to offer.
That's great. All right, Dr. Smith, you get to finish us up.
Hey, Bill, first of all, thank you again. And I really appreciate meeting the two of you, Kevin and Catherine, and appreciate your expertise. None of us are the true expert on this because this is a brand new thing. In 30 years of practicing medicine, I've never had anything like this in my career. But I kind of boil it down to, as I've always said to my family and those around me, when we look at activities that we do, we look at the risks and the benefits. If the benefits outweigh the risks, let's figure out how to do that activity. If the risks outweigh the benefits, maybe we need to step back and look at the risks more and see how we can reduce those. But we do need to, at this point, put on our unselfish hats. We cannot be selfish in this. We need to think about protecting others. And if we protect others, we protect ourselves, and then we get to continue to do this that we like to do. All of us in this meeting today love sports, or we wouldn't be doing what we're doing. And we see the benefits of sports and activity and exercise. And so how can we be the experts on helping students, young people, get active so they achieve the benefits but reduce those the risks? But again, it's great to talk to you all. I'll listen to this as much as I can. We'll be busy next week in the office. But I can't wait to hear what you have to say, Bill. We appreciate you.
All right. Thank you guys so much. Appreciate it.
Much.
We'll get back with you guys. It'll be all over. We'll be talking about it. So thank you so much. Very, very important conversation. And I just appreciate your time. Thank you.